outline, you're going to find our regiments for the patients. And every practice is a little bit different on what they do, but we wanted to provide you with kind of a generic regimen for a few different types of people. You're going to find people coming into your office that are in a lot of acute pain. Those types of people, their number one goal is to get out of pain. So for those types of individuals, they could use the machine up to twice a day if they had to, if they were able to come in. Once they've used the machine for a few weeks or a few days, however long it takes to get out of that acute pain, then they're going to kind of graduate to the next level. And this is the type of person that comes in with just, range of motion pain. Maybe they were hurt playing a sport or have an injury of some sort. But basically, an injured person just has some range of motion pain, basically. They're trying to do something and they can't do it. So they're coming to see you to try and get their knee better or their shoulder better or their back better. That type of patient, we'd want to see them at least 2 or 3 times a week. And hopefully we can get them to graduate to the next level. The next type of person is just kind of everybody else. You have people with just chronic things, from old injuries or maybe some circulation issues or inflammation issues that they're dealing with. And that's just kind of everybody. The goal with each type of these patients is to get them on a regimen. And the acute people are going to use it a little bit more frequent. The people with just a little bit of range of motion issues are going to use it maybe a little less, maybe a few times a week. And then people with just common chronic inflammation stuff, we're going to just set them on a regimen that may take them about a month to do, maybe once or twice a week. So read through your outline, go through the regimens. We're here to help for your specific type of practice if it's a little bit different than others. But definitely want to make sure that when somebody comes in, we know what kind of regimen they're going to go on, whether they're acute, some range of motion pain, or if it's just something chronic and a lot of inflammation. The goal with the patient is to keep their cells charged. When you do a session of PEMF, this charge is going to last about 3 or 4 days. So when I look at a patient, I want to get them charged up for about 1 month. Okay, so if they come 3 times a week for 4 weeks, it's going to take about 12 sessions to keep that charge going in their body. So when you look at a patient that walks through that door, you want to think about them holding that charge for an entire month. After a month's time of using PEMF and every single cell having a brand new battery and being signaled to repair and replace cells, that's where the real benefit is of PEMF. People are going to feel better after 1 session, but they're going to feel great after a regimen of about a month's time, and their entire body is kept charged during that time. So think about when you're working with a patient to not only make them feel better today, but let's try and get some long-term results with them over a month's time and keep that body charged up.